And insurance is this business where if an individual faces misfortune, an accident or a death, then the society comes forward and help. It is indeed a great business, sir, and it's indeed a noble scheme. But, sir, it is unfortunate that despite it being needed by every country, especially the poor in our country, the insurance penetration has been dismal, sir. Sir, the opposition leaders talked about today earlier, blindly talked about during Nehru's time, they nationalized insurance companies. It did well. During Indira Gandhi's time, they nationalized insurance companies. It did well, sir. But they forgot to mention something, sir. Sir, the penetration of some of the insurance was as low as 1%, sir, when they nationalized it. Today, health insurance is almost 50%, sir. And it's not just for the rich. They'll say that, no, it's only for the rich. No, sir. Almost 40% of that goes to the poor with the government schemes like Pradhan Mantri Suraksha Bima Yojana and Pradhan Mantri Atal Pension Yojana, Ayushman Bharat, and the coverage is almost 40%. It goes down to the bottommost, sir. So is that good, sir? Absolutely. They talk about nationalization as being good, but that's when the penetration was the lowest. But strangely, sir, they forget to talk about P.V. Narasimha Rao ji. Why do they forget to talk about P.V. Narasimha, who actually privatized and turned the country around, sir, and that paved the way for privatization. And each year, when the privatization kept increasing from 24 to 49%, 49 to 74%, and now it's going to go to 100%, the penetration kept increasing, sir. The benefits of insurance is reaching the poor, sir. 33 crores are covered under Suraksha Bima Yojana, sir. Just 20 rupees for 2 lakh rupees premium if someone dies or accident. Pradhan Mantri Jeevan Jyoti Bima Yojana is just about 36 rupees a month, sir. And it's a life insurance that they get about 2 lakhs at the end of this, sir. And this is going to the lowest and the lowest of the pyramid, sir. Sir, insurance penetration in India is still a long, long way to go, sir. And that is why the foreign investment is required. And foreign investment is not, it can be anybody, anywhere. It doesn't prevent the local. The local players are actually being encouraged by reducing the paid-up capital amount, sir. So the insurance penetration will increase. It will create more jobs. So when it went from 74%, from 49 to 74, 55,000 crores FDI income came into the country. And now it's expected when it goes to 1 lakh, when it goes to 100%, close to 1 lakh rupees FDI investment will come into the company. It will create direct jobs, sir, but more importantly, indirect jobs as well, sir. The agents will increase, but not only they'll increase, they'll be more profitable, sir. I think earlier this morning, Premachandran ji was very concerned about the agents, sir. Life insurance agent, LIC corporation agents. But this is a bonanza for the agents, sir. Before this bill, the agents were tied up with one insurance company. They were locked up. Those locks are unshackled, sir. If I'm a life insurance LIC agent, I can't sell some other product. If I'm some other Bajaj agent, I can't sell. I was locked up and chained up, sir. Now I'm unshackled. I can sell any insurance. I can take any agencies. I can sell health. I can take general. Their profitability increases and their numbers increases, sir. Today, they are approximately 70 to 75 lakh insurance agents, sir. I'm very confident it'll almost double in the coming years with this, sir. But it's not only deeper penetration, sir, or the investment that it will bring in. There's one more, even more important thing, sir. Insurance promotes responsible behavior. and it penalizes irresponsible behavior. I'm not just talking about cigarette smoking or rash driving of cars, sir, but or unhealthy lifestyle in many other ways. For example, sir, nowadays builders build buildings in unsafe areas, in lakes, and they get flooded. They build gated communities that get flooded, or sometimes even washed away when there's torrential rains. So in most developed countries, even if he's getting the permission illegally, and he builds the building, the insurance company will not give the insurance, sir. If the insurance company does not give the insurance, the bankers will not give the loans, sir. And if the bankers don't give the loans, the product is unsaleable, sir. In a way, it also can check the corruption, sir. So it promotes responsible and right behavior and penalizes wrong behavior, sir. So there's a BPO in my constituency, sir. By the way, the IRDA also is in my constituency. That BPO just checks in United States whether any building is in a flood zone, in 100-year flood zone or 50-year flood zone and 25-year flood zone, and accordingly the insurance pays, sir. So insurance promotes responsible behavior in a society, sir. It's indeed noble, and the penetration should increase, and I don't think anyone should oppose the penetration of insurance, sir. Beside the number of agents, there are also so many other, like point of sales person, about 29 lakhs, sir. All of these will benefit. But more importantly, sir, anyone can't become an agent. They have to write an exam. And this exam is going to become tougher, sir, because before it was a separate exam for, let's say, life insurance, separate for health and separate for general. Now it's a composite. They can sell any product. The exam may be difficult, but I'm sure all these agents will pass because India has brilliant people. But I request for rural penetration, this exam should be in every regional language. So it should be in Telugu, because in my villages, the insurance penetration is very low, sir. So just for example, sir, the GDP contribution of urban India is very high, 55 to 45. Population split is low. But if you look at the insurance offices, it's less than 2% in rural India, sir. So this, I think, we need to really look into it. The other good thing is composite insurance, sir. LIC could sell only life insurance. Now it can sell multiple other insurances. So they are not restricted. This is a very good thing. But even more, an insurance company cannot do any other operations except selling insurance. But now they can merge a financial services to the insurance, sir. So it is good, but also there's a risk. Because the foreign players can have an unfair advantage, sir. They can have an unfair advantage because they have deep pockets and unlimited funds, whereas our players may not have the deep pockets, sir. So IRDA should be very careful. If they merge a financial industry company with an insurance company, they'll have even more deeper products. And then there'll be a cap and restrictions and ratios that IRDA puts. They have to be scrutinized even more, sir. Otherwise, the bigger players will have a greater advantage and smaller players will not have that advantage. So composite license is good, and insurance, non-insurance business merging is good, provided IRDA truly acts like a watchdog, sir. But before I conclude, sir, 2 points about healthcare. The healthcare is very, very important, sir. So when it comes to healthcare, much is to be discussed. But if you look at the healthcare system in our country, it is called healthcare or hospitals, but actually it's a sick care industry, sir. They get compensated by the sick, not by the healthy. So on one side, you have a healthcare industry that compensated by the sick. On the other side, you have an insurance business which get compensated by wellness, sir. So two conflicting interests. Now, if these hospitals and healthcare industries are encouraged to get into the insurance business, then the healthcare business will truly turn from an illness business to a wellness business. They'll promote yoga, they'll promote gyms, they'll promote preventive health checkups, and most hospitals do not do that, sir. They depend on sickness, and I think that is very, very important, sir. But one more last, again, an important factor, sir. The most expensive insurance is healthcare, is the farmer's insurance, sir. If you take the premium to the claim, the farmer's insurance are the highest, and the cheapest is general insurance. Healthcare and farmer insurance are the most expensive. Sir, if you take any product or service in the country, if you take a car in India, a car in a developed country, it costs the same. If you take a ton of steel here, or a 3-star hotel or 5-star hotel in here and abroad, it's same, or maybe in India it's more expensive. Even if you take a ton of steel or a ton of aluminium or a ton of cement or a ton of wheat also, the price in India is comparable to the developed countries. So there's only one product or service which is cheaper in India, and cheaper by 5 or 10 times is healthcare, sir. Yet, it is unaffordable. So it's very, very important, sir. The penetration should increase more. And so one more thing, sir. I think my honourable member has just said that it's socialize. He mentioned socialize loss and privatize gains. Sir, it is now, sir, it's reaching the bottommost. The benefits are socialized. It is then, sir, Agriculture Insurance Corporation, I was there in the 16th Loksabha, sir. Agriculture Insurance Corporation, continuously loss-making. The methodology of giving that crop cutting, a very primitive and very low penetration, sir. So it actually was not insuring the farmers, it was insuring the banks that was giving loans to the farmer, and it was compulsory, sir. If I take a bank loan, I have to take, even if I don't like it, I have to take that, and the banks would cut the premium from my pocket, sir. But today, even if I'm not taking, the farmers are voluntarily, about 40 to 50% of the farmers were taking loans voluntarily. And it's not socialized, sir. They put a cap.
Thank you.
And, sir, before I conclude, I request the Finance Minister one last thing, sir. See, it's not just the funds, because insurance is a trust and knowledge business, sir. You build trust over ages or trust through advertisements, but knowledge is important, sir. It's not enough if I have a lot of funds, but I should have knowledge. Now, today, with artificial intelligence, actuarial sciences, the foreigners may have much more deeper knowledge about India than our Indian companies, sir. So it's very, very important to set up a very advanced actuarial science and research center, and this knowledge should be public domain, so all insurance companies are on the same, so the foreign companies do not have an advantage in terms of knowledge of our business, sir. So thank you very much, sir. With this, the Pradhan Mantri's vision of insurance for all, Sabka Bima, Sabka Raksha, may happen even before 2047, sir. Thank you, sir. Jai Hind.
Thank you very much. Next speaker, Sri Utkarsh Verma ji.
सबका बीमा सबकी सुरक्षा विधेयक 2000